Within this video, there is a scenario of a wild hare suffering with hyperthermia, which is heat stroke, due to the hot environmental weather. It will show the first aid that needs to be provided. When completing a primary assessment of a wildlife patient, it is important to include a full clinical assessment, including hydration status, body temperature, and evidence of pain. Hares have maxillary arteries that do not collide with blood when temperatures rise over 39 Celsius, and their cooling mechanisms do not function. This creates a high risk of hyperthermia. The clinical signs of hyperthermia are that their breathing becomes rapid due to the body temperature rising, which increases their oxygen consumption. Water droplets may also appear on their nostrils, which is caused by the condensation and can lead to serious nasal secretion. The patient may also show to be listless and have cyanotic mucosa and bloody secretions from the nose and mouth. And when the hare does not respond to the external stimuli, it shows that the conditions are critical and need to be taken into veterinary care immediately. Wild hares are awake and can be difficult to capture as they're still mobile. Due to this, it is recommended to use nets and cage traps, as the photos show, to capture and restrain them, as it will help reduce the risk of further injury to the hare, along with preventing them from escaping. Another method of restraining the hare is by wrapping them up in a towel or a blanket. This is more commonly done with wild hares which have an injury making them immobile. Physically handling wild hare can be done by grasping the scruff and supporting the hind legs back with the other hand. This helps reduce the risk of the animal kicking and escaping and supports their back, which can easily be damaged. It is important whilst they are being restrained and handled that their stress levels are minimal, as high stress can lead to renal failure and reduced gut motility. The patient should be transported into the veterinary care as heat stroke is a medical emergency. They should be placed in a comfortable area room within the practice, placing regular humidification of the ears, like lukewarm water, to help regulate body temperature. This is the most common form of treating heat stroke. Using iced water wrapped in a towel or immersing the patient in cold water should be avoided. This could lead to hyperthermia, which is the low body temperature, leading the risk to heart arrhythmia or cardiac arrest. It's common with heat stroke that the patient will be suffering from dehydration, so it is vital to administer fluids by perfusion. The solutions as stated on the screen are the most commonly used. Other solutions, such as hypoosmolar solutions, should be avoided, as this can increase the risk of brain swelling. The patient must remain under continuous monitoring for a few days to help spot any side effects of the treatment. Maintenance fluid requirements are 75 to 100 mg per kilogram per day. After treatment, the patient must be kept in a suitable environment during their recovery process, where it suits their needs and allows for easy observations and handling to ensure that they are recovering. When a patient does not need to be handled, they must be placed within accommodation where they can easily exercise and express their natural behaviours. The enclosure must be adequate size in height and length, contain suitable substrates, prevent escape, and allow the area to hide. Figure 2 shows the suitable feeding needs of a wild hare whilst they are within care. It is essential to provide natural types of food presented as natural as possible. The patient must go through a health assessment before being released into the wild, including a complete veterinary examination to ensure that they are fit enough for survival and do not have any diseases to avoid transmission to the wild populations. When releasing rehabilitated animals, the individual must be fit enough to their wild counterspecifics by being able to locate food sources, forage and hunt, avoid predators, avoid human-animal conflict, complete food, defend and maintain territories, adapt to variations in temperature and conditions, have the ability to reproduce and hibernate or migrate successfully. There are two methods of releasing wild animals. The hard release is where they are released without the support, feeding, or other resources, and the soft release, where they are released without using the enclosure that allows for it to accumulate to its new environment. There are different factors on the type of release that is used, including species, age of animals, length of time that the animal has been in captivity, the location for release, resources available, and the experience of the rehabilitation. Here are the references shown for the information gathered throughout